Good afternoon and welcome to NOCC's Ask the Expert series. I'm Alana Feuchter, Senior Manager for National Programs, and we have two special guests with us today, Heidi Donovan and Mary Roberge, to talk about caregiving. We all know that caregivers are the unsung heroes in any ovarian cancer survivor's journey. Today's Ask the Experts will explore the unique needs of caregivers, the common stressors you experience, and the NOCC and University of Pittsburgh School of Nursing future programming plans to assist caregivers. At the end of their presentation, our experts will answer questions, so please type them in the chat box below at any time. Keep in mind that we will not be answering any questions to specific audiences, only general questions that pertain to a larger audience. Now I'm delighted to introduce our speakers. Dr. Heidi Donovan is a professor and vice chair for research in the Department of Health and Community Systems with a secondary appointment in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the University of Pittsburgh. Her research is in the development and testing of self-management interventions for patients with cancer and their caregivers. Heidi has been involved with the NOCC since 1999, when she was a doctoral student at the University of Wisconsin, and she sits on our medical advisory board. She also is active in our Pittsburgh chapter. Mary Roberge is a research nurse, interventionalist, and project coordinator at the University of Pittsburgh School of Nursing. Mary received her BSN from Villanova and has been an RN for 31 years. She has spent the last 15 in the field of nursing research and has completed several studies pertaining to caregivers. Among her recent efforts, and in collaboration with Heidi, was a caregiver and patient unmet needs study conducted at the McGee Gynecologic Oncology Clinic. She is particularly interested in establishing priority needs of caregivers for women with gynecological cancers. Welcome, Heidi. Welcome, Mary.
Thank you.
Thank you, Alana. Mary and I both want to thank you for inviting us here today to talk about a topic that is near and dear to our hearts. So let me first talk about what we plan to do. And we don't have slides. We're going to just talk about these issues. And let me just give you a brief overview. So first of all, we're going to just talk about, who are caregivers, what do we mean by family caregivers, and talk a little bit, again, very briefly about the importance of family caregivers, not only just to patients, but to our healthcare system and to the country and our economy as we know it. Then we're going to talk about some of the data that we've collected about caregivers and their needs and the extent to which their needs are being met within our current healthcare system. After that, I'm going to let Mary talk about what we currently do. So like I said, we've done a lot of research in the needs of women with ovarian cancer and their family caregivers, and we've used that information to develop both patient and caregiver support programs. These have been done previously in research by our team, but we, over the past 2 years, have really worked to implement what we've learned through research into an actual family care center in the Gynecologic Oncology Outpatient Clinic at McGee Women's Hospital. And so Mary's going to tell you a little bit about that. While I'm a past gynecologic oncology nurse and chemo nurse, I've spent the last most of my career as a researcher. And Mary's had the job of taking the research ideas and making them real. First of all, as an interventionist in our research studies, and now in our center. And she just, for me, the wealth of knowledge she has developed through the years is really fabulous. So she's going to share the work that she does in our clinic and how we do that. We'll talk about some of the tips, sort of take home tips that we have that are appropriate to this very short setting. And then we'll wrap up, like Ilana said, talking about this really exciting collaboration between the University of Pittsburgh and NOCC to really develop an online caregiver support and education program. So we'll finish up with that. So that's our basic plan. So what is a family caregiver? When we talk about family caregivers today, we're talking about the trusted individuals in a woman's life who help her to manage all of the challenges that cancer throws at her. So coping with the diagnosis, coming to understand the diagnosis, managing the side effects of treatment, the effects of cancer, working to help the woman with cancer and the rest of the family find a new normal after cancer, and for some, helping women through the end of her life. So that's what we mean when we say family caregiver. Other people call it, a care partner, a support person. For the most part, I'm going to stick with family caregiver throughout the rest of my discussion. So the first thing to know about family caregiving is if you're a family caregiver, you're not alone. Rosalind Carter, President Carter's wife, who's been really instrumental in raising awareness about the needs of caregivers and the importance of caregivers. She once said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And in fact, if you look at statistics, there are currently 5 million family caregivers providing care to the more than 16 million cancer survivors in the United States. And as those of you know who are family caregivers, our healthcare system is constantly asking families to provide more and more of the care to patients with cancer. And that care can range from, the normal thing that we expect, the social and emotional support of family members with cancer. We depend on family caregivers to navigate and help the patient navigate this just overwhelmingly complicated healthcare system that we have. And more we're asking family caregivers to actually provide the medical care to patients, like dressing changes or injections. And this care is essential to patients. And like I said before, it's also essential to the healthcare system, but it really truly is essential to the whole economic functioning of our country. The estimated economic value of this unpaid care is more than $47 billion a year. And that is the most recent data from that. Really, it was 2013 when this was calculated. And so we can only presume that that number is higher now. So despite the fact that family caregivers are essential to every single aspect of the care of people with cancer, I'm sure many of you know and have experienced that family caregivers are rarely trained or supported to carry out this essential role. So one of the surveys that we conducted in the Gynecologic Oncology Clinic at UPMC prior to starting our family care center, we found that of a list of 28 potential distressing unmet needs, the majority of caregivers reported 9 or more distressing needs that had not been met within the healthcare system. So that's a lot of different issues in which caregivers just don't feel like they've been prepared to carry out their role. And to sort of highlight the problem in the system, less than 1/3 of caregivers reported being asked about their needs as a family caregiver within the gynecologic oncology setting. And this is a fabulous gynecologic oncology program with incredible people doing amazing things for patients. But in that setting and in most settings, family caregivers aren't really recognized as a part of the healthcare team. And as having their own unique needs. So as we looked across the country, there are very few systems that exist in most healthcare settings to identify, assess, and support family caregivers. So like I said, over the past 15 years, our goal has been to better understand the day-to-day needs of women with cancer and their families and develop programs to support them. So in that work, we've identified the most common frustrating and distressing issues that family caregivers face. And Mary's going to go over some of that with you right now as she talks about more about our family care center at UPMC McGee and what we do to support family caregivers in this area.
Thanks, Heidi. So I'm going to talk about what we're doing here in Pittsburgh. And I just want to say that for anyone in the role of being a caregiver, when someone you love receives a diagnosis of a gynecologic cancer, you're in this together and with her every step of the way. So for the sake of clarity, I just also want to say that because my primary work setting is in an outpatient gyn-oncology clinic, I'm going to use the word patient when I refer to the woman who has the cancer diagnosis. But we also describe this woman as a survivor. So I'm going to just use the format of who, what, when, where, and why to sort of go through this. And so who are these caregivers of these patients and survivors? We begin by explaining to the patient that we often refer to this person who is their support person as a caregiver. We identify a caregiver by asking the patient that has the cancer diagnosis if it's okay to talk to that person who fills that important role for her. We gather information about that caregiver to help increase our understanding by asking questions about their relationship with the patient, if they live with that person, if they have children in their home, and ask for contact information, phone and email, and if it's okay to reach out to them. So the what is that we're working to recognize the value of caregivers and what they are doing. We want to hear the voice of the caregiver, and we want to understand what they're saying and identify what they need, and therefore help them provide and offer them information, education, and possibly resources to better manage this important role that they have. When do we do this? We try to meet or identify the person that's in this role of caregiver as soon as possible. Sometimes that happens very early in the process, and sometimes it's later. The most important thing is that it happens. So hopefully we can become a source of support for that caregiver. Where do we make this happen? We try to make this connection by taking advantage of any and all opportunities to identify a patient and their support person caregiver. This sometimes takes place at a new or post-op clinic appointment, or sometimes we meet them on the inpatient unit of the hospital. We also attempt to follow up with patients and caregivers in the infusion center where the patient may receive her chemo treatments, however, not during this pandemic. And why? So we do this so that we're able to assess how the caregiver might describe their personal distress level and to hopefully identify the issues that contribute to the distress they're feeling. We offer caregivers a list of issues that others who have maybe walked in their shoes previously have often identified as issues that if they had received help, it might have eased some of their distress. So these issues range from things that are specifically related to the patient, the caregiver's loved one oftentimes, as information on cancer and cancer treatment, to managing patient medications and symptoms. A tip that we often offer to caregivers about this is that it is really important to make it clear to healthcare providers and to other family members that you are that critical person who is managing that role. Other issues that are specifically related to the caregiver are caregiver's own emotional and physical health, finding time for yourself, and also what is your self-confidence in this role of caregiver. A tip that we sometimes offer for this is that to be aware of the importance and significance of taking care of yourself, both emotionally and physically, by thinking about that adage that's given when you first get on a flight, which is to put on your own oxygen mask first before trying to help others. So examples of this are, keep your own wellness visits, don't ignore your own health issues, make sure you follow healthy habits for eating and exercise, among many others. Other issues are kind of more concrete type issues that deal with financial and legal issues, transportation, parking, work, employment issues. And a tip sometimes that we offer is it's very important to try to reach out to the oncology navigator or social worker where your loved one is receiving care for help with these types of issues. Maybe begin a conversation with your employer about the process for FMLA or some other time away options. The NOCC offers a great link to organizations that address financial and supportive needs of families facing cancer, and this can be found along with others on the NOCC website at ovarian.org. Other issues that sometimes are even harder for caregivers to define sometimes include things like spiritual concerns, relationship with their loved one, and also family dynamics. A tip sometimes that we offer for this is to make sure that you have some outlet for talking about your worries or your fears. Strength can often come from being able to share with others, and support can come from professional counselors or therapists, your friends and family, and your faith or religious community. One of the last groups of issues that we present to caregivers so that they can think about them are communication. And that can be talking with others about cancer and communication with healthcare providers, which is so key. A tip for this is ask for guidance about how to talk with others, including age-appropriate explanations for your children or your grandchildren. And to keep in mind that all of your healthcare providers want to know if you understand what questions each of you might have. And think of yourself maybe as a reporter that you need to both give the details and get the facts. Go to appointments with a pen and paper and be prepared with a list of questions that you want to ask. Being prepared is both helpful to the healthcare provider as well as to both of you. Some of the most well-received resources that we share with caregivers include issue-specific guides that provide current evidence-based approaches to helping caregivers identify, describe, and manage these various issues. So a copy of these guides will be included in resources provided to you by the NOCC after October of this year. So now I'm gonna turn it back over to Heidi, and we'll answer questions later.
Thanks, Mary. That's great. I just wanted to add one more of our, I think maybe it's a mantra of ours that sort of builds on what Mary said about taking care of yourself going through this. And this is about the very difficult but so important issue of asking for and accepting help. So we do a lot of coaching of family caregivers about how to do this. So I think, the first point is recognizing that at every level of support you provide, which, comes and goes over time. There are times when you have to do a lot and other times when you don't need to do as much. But, your ability to take on additional tasks while balancing all of your other responsibilities in life are limited. You can't take on an infinite amount of new tasks. And although asking for help might not be easy, whatever the barrier is, we always encourage people to recognize that they can't and shouldn't do everything by themselves. So as the primary support person, you really have 3 options for making sure that all of the care that needs to be done and all of the support that needs to happen is done. You can do it yourself, which we're arguing you shouldn't do. You can coordinate other family, friends, or volunteers to help you, or you can hire outside help. Interestingly, studies show that only about half of family members caring for someone with cancer actually ask about or look for help, and that's informal or formal help. So to us, that means that there are a lot of stressed out and burnt out family members who are doing everything for themselves, and it's typically one person in the family who's doing more than their fair share. So, why is it so hard to ask for help? Again, if you're feeling that way, you are not alone. There's a lot of information out there that says that we can list them in a lot of different ways, but I sort of think of it as 4 different ways. So caregivers have a sense of responsibility to be the sole caregiver. They or the patient might feel like nobody can do the job as well as that primary caregiver can. There's a sense of guilt, feeling bad or feeling weak for asking for help, feeling like no one steps up to offer, or feeling like even though if you want help, you don't have the energy or the time to organize help, or you don't know who or what to ask in terms of help. So what we like to share is 4 quick questions that you might consider when you're trying to decide what among the support and tasks that you are providing that you might be able to delegate. And the 4 simple questions that we encourage you to ask about each task that you do is, how valuable is the task to helping your loved one have the best quality of life possible? How much personal value do you get from doing it? Does it bring you joy and comfort to your loved one? To what extent could you let it go? And to what extent could someone else do it on your behalf? And those are 4 really important questions. And if you sort of think about that related to the scope of what you're doing, you might be able to see which tasks are important and meaningful and well suited to you and your skills, compared to those that you don't enjoy, that maybe you dread doing, you don't feel good at them. And maybe you could find another family member who's more well suited to that task. So once you find those, make a list of those tasks, have them ready for the next time someone says, please let me know what I can do to help. And as you get good at it, then you can start reaching out and actually asking for help. So that brings us to the end of our tips. In our presentation, I do just want to follow up for just to make people aware of what's coming up in the fall of 2020, hopefully for an October launch. Please look for an invitation to participate in a survey of family caregivers to identify a survey of family caregivers that we'll be doing. And we're using that to identify needs of caregivers and sort of preferences of family caregivers to how to receive that support. We'll use information from that survey to guide the agenda and curriculum for a new online caregiver support and education program that we're going to launch nationally. And then, like Mary said, we're going to release a caregiver guidebook, which will have evidence-based information and sort of a workbook for 18 of the most common issues that we see among caregivers. I do have a screenshot of one of these if I'm able to do it. This is one of our most important and most used guides. Oops, sorry, we're in the wrong place here. I hit the wrong button. Let me try one more time while you're gathering questions. Okay. Can you see the guide, Mary?
I can. Maybe click on the side of your screen. You can move it up or down.
Yeah, that's right. Okay, there we go. So you can still see it there. So this is our guide of caring for the caregiver, maintaining your health as a caregiver. And each of them has an overview of what the guide will help you to do. understanding how, in this one, how important maintaining your own health is. Some of the things that, you might resonate with as a caregiver, and then really getting into some of the cause of some of these issues, and how to address them. So each of the guides will follow the same format. There's spots for writing down your thoughts, some of your barriers, and then making a plan of what you're going to do. So again, this will be put together in a book that we will share with NOCC to distribute. And with that, I'm going to wrap up and look forward to hearing some of your questions.
Thank you so much, Heidi and Mary. I know that what you said resonated with many people because there are lots of hearts floating up and a lot of people that say true, so true. So, so the people that are experiencing what you were talking about really, agree with what you were saying. We do have a few questions, and I encourage other people to add questions as we go through these. What's the best way for a survivor to convince their caregiver to seek support?
Nice. That's a great question.
So I'll answer part, and then I'm sure Heidi can add something as well. Very often, it's almost like giving permission to somebody to seek the support that they need just to take care of themselves. And I think oftentimes caregivers that I talk to every day feel that it should be about the patient and not about them. And so they feel like, I don't want to be the person that the focus is on, because the focus is really needing to be on the patient. And while we do want focus to be on the patient, we have a lot of eyes on the patient. Oftentimes we don't have as many eyes on the caregiver. And so sometimes it's just saying to them openly and honestly, I want you to be well for you, but I need you to be well for me as in addition to that. And so if you're not in a good place, if you're not well, if you're not taking care of yourself, then maybe when I am going to need you, you won't be able to be there for me. And so, it's just a matter sometimes, I think, of saying to them, it's okay. It's okay to focus on you now. This is important.
And I think support can come in a lot of different ways. I think sometimes getting formal support or counseling is hard to convince people to do. So planting the seed is good. But I think, like Mary said, again, saying, I think it's important for you to take some time for yourself. Let's invite somebody else over to spend some time with me. And you go and do something that you enjoy doing and haven't done for a while, and just sort of let off some steam.
That is a perfect segue into our next question, which is, how does one find out about respite care, and is that something covered by insurance?
So I hate to say this, but respite care is like that magical unicorn. It should, it's what everybody wants to see and find, and it is so hard to find. So Mary, do you have any concrete suggestions for people? I mean, you have to know your local area.
Right.
And again, the navigators and social workers at your institution might be able to help you. If the patient has a disability or is older, you can contact local area agencies on aging who may be able to provide some links to additional care. And then there are also private agencies with respite, but it is very, very difficult to find.
It is. And of course, especially during this pandemic, when so many things that normally could be offered are pulled back. The American Cancer Society does have a program, but I don't think they're operating currently. If the patient or the survivor is on Medicaid, there are additional things available because of, but they're based often on what your income is per month based on, Social Security or whatever. there are, as Heidi said, certain agencies, and some of them are local, that offer, again, based on income level, can offer some graduated programs. Again, I think Heidi said the Department of Aging, if you're older, you have more things available to you. But it is absolutely a very common question that we get, and a very difficult question. I know locally in Pittsburgh, I have looked up, I keep a binder of agencies that maybe service a particular area, and they will, if they're local to that area, they may help in some way. But it is really a difficult, but some major, again, but not during the pandemic, some major things like American Cancer Society and other organizations do offer some respite care provisions, but some of them you have to contribute to financially as well.
Okay, it's a hard time, because it's also hard to invite somebody into your home at this point to help them with care. So it's especially difficult.
Not to interrupt you, but some places, and again, I don't know during this pandemic if these are operational, but I know that some people that I have talked to have used, there are some skilled nursing facilities that offer like respite for a short period of time, like a 5-day stretch or a 3-day stretch. And I'm not going to mention them by name because they're here in Pittsburgh, but that might be worth checking into for somebody if they're local to a, if the patient has hospitalization, medical care, insurance, that might cover that at a skilled nursing facility for a short period of time.
That's great information. Thank you. Another question we have is, what would be some signs that a caregiver may be burning out?
Yeah, so I think so. Some of the things we see is so a lack of interest in their normal activities. It can look like depression, actually, right? So feeling very tired. I think quick to anger. Or quick to be emotional and tears. Those are some of the classic, I think, the sort of shutting down. And I think probably more than anything, not finding the good in everyday life, and kind of a skewing towards more negative responses than is normal for them.
I agree. And a sense of hopelessness is a very common thing that sometimes caregivers that I talk to that are burning out, that is, they don't even have an interest in maintaining their own personal hygiene anymore. They sort of are giving up and saying, for what reason, to what end am I doing all this? And, again, it's really important to have an intervention at that point in time, because for all the same things that we discussed earlier, that's a really hard, it's harder to come back from that than it is if you can catch it early on and have some things that intervene and prevent that, slippery slope from getting on that slope.
And I think I would just add one more thing too. We talked the question about respite, and I don't know exactly whether they mean the formal respite, meaning somebody to come in and provide medical type care or, activities of daily living type care. But we also, I think, use the term respite to mean just give somebody a break. And that kind of support, hopefully, that kind of respite can be rallied through friends and family. And, I think each of us always, when we have friends or family going through a crisis, people want to step up. They want to feel useful. They want to help out. And, between the person with cancer and the primary caregiver to come to an agreement that time off from each other for both the patient and the primary caregiver is important, and that people need that break and they need other outlets. And that's a really great way to rally friends and family for a little bit of time out. Yeah, time away.
You keep answering and leading me into my next question, which will be the last question since we really are out of time, but I think it's an important one. And that is, what kind of services or websites do you recommend to help caregivers seek some of these other support systems?
So the American Cancer Society has really one of the best, I think, currently set of resources for family caregivers. That's cancer specific. NOCC also has some good resources for family caregivers, and after October, that would be even better.
Right.
The other thing is to look outside of cancer caregiving. So I think the most important organization I would encourage people to know about that's outside of cancer is the National Alliance for Caregiving. So they have incredible resources for family caregivers. They're an advocacy organization, and they have regular newsletters. And then the other funny one to think about is AARP. Again, because so many older individuals have caregivers, that's where a lot of the initial caregiver resources came from. And so they have a lot of great information as well. So I'll stop there because I'm sure Mary has others.
Well, you've stolen my thunder there. I was going to say Agency on Aging and AARP, because that's not one that people usually think about. And I know when I have said that to people, they say, isn't that where you get like insurance? They just don't even think of that, but they have great provisions. And so, yeah.
Yeah,
those are great tips. Well, I think based on the comments and the hearts and the yes, you are right on. I think today was very valuable for our caregivers and for our survivors also who are worried about their caregivers. And I look forward to the partnership that we are starting and that is only going to grow and hopefully benefit caregivers in the future. So I thank both of you for your time and your commitment to this audience, because without wonderful people like you, they would be forgotten. So thank you very much.
Thank you, Alana, and thank you for inviting us to be here and to be part of this collaboration.
It's our pleasure.